Now it is my honor to introduce our speaker for today. Dr. Ubaka Ogbogu is an associate professor in the Faculties of Law and Pharmacy and Pharmaceutical Sciences. He is the Katz Research Fellow in Health Law and Science Policy at the University of Alberta. He's also a Pierre Elliott Trudeau Foundation Fellow, as well as a recipient of the Confederation of Alberta Faculties Association Distinguished Academic Early Career Award. He is a nationally recognized expert in the fields of health law, public health law and policy, law and science, and bioethics. We are so pleased to have you with us today, Professor, and now I turn the Zoom room over to you.
Thank you, Anastasia, for that kind introduction, and welcome everyone. It's nice to meet you, whatever that means in this era, or to meet your names, because what I see on my screen is some of you, and then just your names. It's an absolute pleasure to have a conversation with you today about a topic that I know is top of mind for a lot of people. It's a topic that tends to attract quite a bit of controversy, and I'm happy to be talking about it today. So I'm just going to take a moment here to share my screen with you so you can see my slides. Let's hope the technology works. We tested it out and it did work, so just give me a second. Okay, I think that's, can everyone see it? Fantastic. Okay, so I want to talk to you about vaccination policy in a COVID-19 world. My focus is going to be on how you design vaccination policy, seeing as we know that vaccination is very controversial and tends to be controversial, even though we also know that it is very necessary. It's a necessary thing for the purpose of controlling infectious diseases and for keeping our communities safe. So I'm going to talk about how you design policy and the kinds of considerations that are going to design in policy for vaccination in a world that has been changed by this COVID-19 pandemic. We all know that there's teams around the world working on a vaccine for COVID-19. And when those vaccines, if and when they become available, we'll need to find some way to get it to people. And issues around how you distribute the vaccine, how you make sure it's safe and effective for the target disease, these things tend to be things that cause a lot of people to lose a lot of sleep. And so we're going to talk about some of those issues today. But I also want to talk about vaccination policy in general. And in particular, how I think the government should use its power to implement vaccination programs. I'll be talking specifically about the notion of mandatory vaccination and what that means, both for a COVID-19 vaccine and for vaccination in other contexts, particularly in the context of childhood infectious diseases. So that's my focus. Now, I'm an academic, and if you give an academic 30 minutes to speak about something, they'll take 3 hours. I've been asked to speak for about 45 minutes, and I don't want to keep you here for 5 hours. So I like to always start with my conclusions. That way, if I run out of time, at least you know where I was going. Because I'm an academic and that tends to happen. We always have a lot to say. This is a topic I've been studying for years, and I do have a lot to say about it. But I like to allow time for you to ask your questions. So I'm not so worried about getting to the end, but I will make sure to tell you what my conclusions are before I begin. So I'm going to talk to you about how there's no one-size-fits-all vaccination policy. What I mean by that is that for different vaccination programs, you're going to have to think about what kinds of considerations are at play with that program. And in designing policy, you may need to highlight or prioritize certain considerations over others to design that policy so that you can have a policy that's effective for the vaccination program that you're planning to implement. So you just can't have one policy that applies to every vaccination program. You can't say, well, look, our policy is mandatory vaccination, and we don't care what kind of vaccine comes along, we're going to make it mandatory. So that's the first thing I'm going to try and convince you of, that in trying to design vaccination policy, you have to look at what vaccination program you're actually talking about and design a policy that matches that program. I will argue that we don't need mandatory vaccination for a COVID-19 vaccine. We don't need to make it mandatory, and I will talk about why I believe so. I will also argue that we do need mandatory vaccination for childhood infectious diseases. This is quite controversial, but I believe that there are enough reasons to make it mandatory, and so I will be arguing, or at least trying to convince you, that childhood infectious diseases, vaccines that address them, should be mandatory. I'll also talk about the fact that when it comes to COVID-19 vaccine, what I term distributive justice is likely to be the central ethical issue. What I mean by that is that we're going to have to come up with policies and approaches for making sure that we distribute COVID-19 vaccines in a way that is fair and equitable, in a way that ensures that only that people who are most vulnerable to the disease are the first to get the vaccine, because I think there's going to be high demand, low supply for the vaccine when it does become available. So those are my conclusions. If you have somewhere to be, you can leave now, because I'm going to spend the next 35 minutes or so trying to expand on these themes. Okay, so let's begin. So as I said before, vaccination programs are not created equal, and you can't have a policy that's one size fits all. Different vaccination programs have diverse features and considerations, and so when you make policy for each program, it should reflect this diversity of features and a balancing of considerations. Some considerations will be more important in some contexts than in others. So the vaccination policy you have for childhood infectious diseases will not be the same as the vaccination policy you have for, say, the flu vaccine, because they have quite different features. But what kind of considerations go into policy making? If you're thinking about a vaccination program, what are the kinds of things you should be thinking about in terms of how you make policy? Here are some of the things that over the years I have observed are important to think about when you're designing vaccination policy. So the first thing is the virulence of the disease, the severity or harmfulness of the disease. If the disease is one that is quite severe and very harmful, you should take that into account in designing a policy for whether or not you make vaccines mandatory or not. Obviously, the more harmful it is, the more that increases the likelihood that you're going to want to make sure that everyone gets a vaccine that can actually address that harm. So I'm thinking of a disease like smallpox, for example. I don't know if any of you have had any experience of smallpox. It was eradicated, but when it was present, it was a very severe and harmful disease. It spread very rapidly, and it killed quite a lot of people. So for a disease like that, you might want to think about, if there's a vaccine available, making it mandatory. The second factor is contagiousness. How does it spread? What is the manner of spread? And can the way it spread be controlled by means other than vaccination? Obviously, the more contagious it is, again, that's a consideration that counts in favor of having a policy that ensures that you stop the spread. And if vaccination is the only means of doing so, then you really want to think about how you want to make sure that everyone gets vaccinated. What is the risk to persons who are vulnerable? Is there a vulnerable population implicated by the disease? And will vaccination serve to protect that vulnerable population? Are vaccines available? And can people get access to it? In a situation where the vaccines are available and free, the argument for making it mandatory, I think, will be present. But if it's expensive and people can get access to it, then of course, if you make it mandatory, you're going to create a situation where people are not able to access it anyway. So if it's available and it's free, I think you know, in combination with other considerations, you might want to think about a policy that ensures that people actually take advantage of something that is available and free. Safety and effectiveness of the vaccine is very important. To me, it should be the top consideration. Is it a safe vaccine? Is it effective? The more safe and effective it is, and the more that it confers, the more immunity it confers. So if it confers long-term immunity, you get it once and you're good for life, or you take a couple of doses and you're good for life. That again, I think, is an argument in favor of making sure everyone gets it. Do you have remedial treatment available? So are there any alternatives to vaccination? And are those alternatives available? And can they work? How do they work compared to vaccination? So if you're thinking about the COVID-19 vaccine, for example, we know we have some alternative measures now to control the spread, such as just simply wearing a mask and social distancing and staying at home if you don't need to be somewhere. So we do have some alternative measures that have been shown to be effective. And so you want to think about those alternative measures compared to vaccination when you're designing policy. You also want to think about the level of herd immunity. Now, the term herd immunity refers to protection of a community from infectious disease that occurs when there are enough people in the population who have immunity to the disease. They can gain immunity whether through vaccination, so you vaccinated enough people in the community, or through natural infection from the disease. So there's enough people who have had the disease and have recovered from it. So you have enough people in the population such that if the disease comes back into the population, it is not able to spread because most people are protected from it. This is what we call herd immunity. Now, if you have herd immunity already, then obviously it wouldn't make much sense to start to implement a mandatory policy when it comes to vaccination. But where there's still a chance that there's going to be a ton of people affected in the community, if you haven't reached herd immunity levels, then you might want to think of a way to ensure that you actually get uptake up so that you can get to the level of herd immunity. I will come back to herd immunity again when I talk about childhood infectious diseases. Interference with personal autonomy and bodily integrity. Obviously, we live in a kind of country where we care a lot about personal autonomy and bodily integrity, and we care about the state interfering with our personal choices and with our bodies. Vaccination does interfere with our bodies, and if the state were to impose it, this will be an interference with our personal autonomy and bodily integrity. But it's for good reason. It's to protect the community. And so there's a balance to be struck between that interference and protection of the community. But you want to make sure that if, as the state or government, you're implementing a policy that's going to interfere with personal autonomy and bodily integrity, there are good reasons to do so. So you have a vaccine that works. It is very safe. There's a need to stop the disease because it's spreading really fast. It's very contagious. It is very serious and severe, and there's no other way of controlling it. You start to see how all these factors come together to create a compelling argument for making vaccination mandatory in some contexts and not in other contexts. So these are the considerations. I want you to keep them in mind as I go through two main types of vaccination programs and essentially make arguments as to why in one case we shouldn't make vaccines mandatory, and in the other case we should probably consider making it mandatory. Okay, what do I mean by mandatory vaccination? So for me, mandatory vaccination means enacting legislation. So the government has to enact legislation that requires the vaccination of persons in the community. according to how experts recommend that vaccination should happen. So vaccination as recommended by experts. A true mandatory vaccination policy only allows for two types of exemptions. The first is a medical exemption. You have a medical reason not to get vaccinated. Say, for example, you're immunocompromised. The vaccines will cause you more harm than good. So that's one reason to exempt people from this mandatory scheme. The second will be that you've already acquired natural immunity. You've been infected with the disease and you now have immunity to the disease. In the case of COVID-19, we know that the science on whether or not you have gained immunity to COVID, to the disease, is not very clear presently. It's not very clear that being affected by the disease gives you lifelong natural immunity. So that is an issue that we're going to have to think about when we discuss COVID-19 vaccines. But for a mandatory policy, you want to think about two types of exemptions: a medical exemption or an exemption based on proof of natural immunity. There are some mandatory policies that allow for, or so-called mandatory policies, in my view, that allow for a religious or philosophical objection to vaccination. In the mandatory vaccination scheme that I'm proposing, and the one that I think is truly mandatory, those exceptions won't be allowed. So the true mandatory policy, in my view, is the one that's designed to allow for only medical exemption or exemption based on proof of natural immunity. Okay, let's talk about the COVID-19 vaccine, because I know that that's why most of you are here. So for the COVID-19 vaccine, I think the following considerations should be top of mind when you're designing a policy with respect to how to get the vaccine to people when it becomes available. I think the safety and efficacy of the vaccine should be the topmost consideration. It is absolutely important that the vaccine is safe and efficacious. A second consideration will be availability and access to the vaccine. Is it available? Do people have to pay for it? Do those who really need it have access to it? The risk to vulnerable populations is also a consideration, as well as alternative measures for controlling the spread. These are the four top considerations that I think should be front and center when we talk about a COVID-19 vaccine policy. And I will explain why I think they are top of mind as I go through what we know presently about the COVID-19 vaccine. So what do we know presently about the COVID-19 vaccine? We know it's in development. Presently, there are 0 vaccines for COVID-19. I know if you go on the internet, you might hear that there are some countries like Russia where they have found a vaccine for COVID. That's not correct. But we do know there's a ton of vaccines that are in the experimentation stage, either being tested on animals or being tested on human volunteers. Presently, we actually have a ton of volunteers, 23,000 volunteers who are enrolled in vaccine trials around the world. We know that this pandemic is taking a toll. It's a very serious pandemic. It's infected over 9 million people around the world. So it's very contagious. We also know that it affects certain populations more than others. So for example, the elderly are very vulnerable to it. Persons who, because of lower socioeconomic status, are exposed to sort of poorer health and poorer living conditions, also disadvantaged, at a disadvantage when it comes to the disease. And so we know there are vulnerable populations that we need to think about. So it's a contagious disease that is quite serious for some populations, but maybe not as serious for others. For these vaccines, we know that there are different stages of research and development. So 125 of them, majority of them are in what we call the preclinical stage. So this is the stage where they're being tested on animals. So they've not made it into the stage where they're being tested on human volunteers. And we have about 16 of them now in different phases of testing on humans. None have been licensed and none have gone into mass production. So there's a big if with this. I know we are all hopeful that we're going to have a COVID-19 vaccine, but it is the case that when it comes to science and development of vaccines and drugs, most of these drugs and vaccines fail. So not all the 16 of them or 141 of them are going to make it to the clinic. If we end up having one, that's actually quite lucky. What that suggests to me is we're going to have, if we do have a vaccine, it will be in very high demand and the supply is likely to be very low. Now, here's some other interesting information about the vaccines that are being developed right now. As you can see, much of it is being developed in what I will call the global West, right? So they're being developed in countries that have, a lot of resources and considered to be much more developed and richer countries. There's many parts of the world where there's no vaccine development going on, but there's COVID in those parts of the world. So if you look at the map and you see the green areas, the light and dark green areas, that's where the development is happening. And then the areas where it's not happening, if you look at Africa, for example, there's no vaccine development happening in Africa, but there's COVID in Africa. And so there's questions around, how do we ensure that people in these populations are actually protected as well? Now, the biggest ethical issue presently with the COVID-19 vaccine is human infection challenge studies. So these are studies where healthy volunteers, healthy human volunteers are deliberately infected with the disease, with COVID-19, with SARS-CoV-2. And we know there's no cure for COVID presently. So there's no rescue therapy. So they're being infected with this disease. And then some of them are given the vaccine and some of them are given a control. So it's actually, something that is, that can lead to these volunteers being harmed. We also know that there's no benchmark for how to determine that the vaccine is safe or efficacious. So this is, taking people who are healthy and just infecting them with the disease and then giving some of them the vaccine in the hopes that it will work. We don't know anything about long-term effects or even short-term effects. And this is actually quite controversial. This is something that brings up a lot of debate in my world. Ethicists and bioethicists debate whether or not it is ethical and moral to actually infect people in this manner when you don't have any way of saving them if they were to get the disease and it were to become really serious. So for that reason, this vaccine is not being tested presently on persons who are vulnerable to COVID. That's important, right? It's not being tested on, pregnant women, for example. It's not being tested on women of childbearing age. It's not being tested on persons 65 and above. There's very few of them enrolled in the study. There's very few children enrolled in the study. It's mainly based on reports that I've seen, mainly adult white males who are predominantly enrolled in these studies. The largest trial presently is out of the University of Oxford. Approximately 12,000 participants are enrolled in it. They are healthy volunteers and patients, and no vulnerable populations are included in the test, as I mentioned already. Their age between ages 18 and 64. You only have 240 participants in this trial, in this Oxford trial, who are above 65 years of age, and again, no vulnerable populations. So what we see emerging with the COVID-19 vaccine is that it's been developed obviously at the breakneck speed. The speed of development is quite unprecedented. And it is being developed in a way to make sure that we have it available as soon as possible and we get it to the market as soon as possible. And this might happen in a couple of years. Now, with vaccine and drug development, that is a very condensed amount of time than what we're used to seeing with vaccine or drug development. Usually it takes 15 to 30 years. And now we're saying we're going to have it in 2 years. We don't have a benchmark for how to know it is safe or efficacious. So this, I think, raises a lot of questions around safety and efficacy. And it raises a lot of questions about what we know about long-term effects. We also know it's being tested in a very specific population. So, we don't necessarily know how it will work in populations that it is not being tested on. So there's all kinds of questions around this. And I think all of this suggests that making it mandatory is likely the wrong policy move. Why? Because we don't have enough information to start insisting that people must get it. And we certainly don't have enough information about safety and efficacy. And I think it's a lot to ask of people to basically become human volunteers for something that has not been shown to have a very well-developed safety and efficacy profile. I think people should still get it, but I think people should be able to have a choice in the matter as to whether or not they will get it. I think the emphasis should be on encouraging those who are vulnerable to the disease to get it. In the case of COVID, we have other ways, alternative measures of controlling the disease. I think we should emphasize those as well, encourage people to get vaccinated, make sure those who are vulnerable to the disease get vaccinated. But I think if we start off by saying make it mandatory, that'll be the wrong policy move, because that will create a lot of resistance to the vaccine. Why? Because people are worried, and rightly so, about the speed of development. They're worried about safety and efficacy issues and all of these things I've talked about. But also, we know that no one can really come out and say, we have good information about the long-term effects. So I think the emphasis should be on making sure that we get it to those who actually need it. It is also likely, in my view, that the vaccine is going to arrive and there'll be high demand, low supply. So I don't think it makes much sense to be insisting on making something mandatory when you can't actually provide access to it for everyone who needs it. And so instead of doing that, I think we should instead try to get it to those who actually need it. I think a mandatory policy in this context will heighten anxiety around vaccines. It might actually lead to a backlash against vaccines in general. And so I wouldn't support making it mandatory. I think people should just be encouraged to get it. But I also think uptake is likely not to be an issue. I think in many ways, starting to debate about whether to make it mandatory or not doesn't make much sense. As you've seen, there's a ton of people enrolled in the trials. 28,000 people is a lot of people. And so there are people who are really coming forward. And even when there's no knowledge about how this is going to work, people are putting themselves forward to be infected with the disease and to receive the vaccine. So they could be impacted by the disease, but they could also be impacted by the vaccine if it turns out not to be what is expected in terms of safety and efficacy. And so the number of people who are enrolled in these trials suggests to me that uptake will likely not be an issue. Of course, you have to consider that there's also a lot of misinformation about vaccines out there right now. And I think there are some governments around the world that are not helping. The government of the US especially is not helping because as you may know, President Trump has been undermining scientific processes that actually ensure that some of these safety and efficacy problems do not arise. So he's been undermining the science. And I think that's very dangerous, because I think what's going to probably happen is if he keeps doing that, when the vaccine arrives, it will arrive with a ton of distrust. And people will not be willing to get it because they don't trust the process through which it's been approved for clinical use. So I don't think a mandatory policy is what we need here. I think it might generate some crossover opposition to vaccines generally. I don't think we need to do that. I think we should focus instead on distributive justice concerns. As I have argued, and as I've shown, the vaccine is being developed and tested on a specific population. And those who are vulnerable are not even part of the testing. And I hope that the distribution doesn't track that. I hope the distribution tracks those who actually need it most. And I hope it also, there's also some consideration for jurisdictions that don't have the ability to compete in terms of development and in terms of acquiring the vaccine. We know that presently, rich countries are buying up stocks. Canada has bought up some. The US has said anything developed in the US will not leave the US. Everyone is being rather selfish about it. The World Health Organization has put together a coalition of countries to try and ensure a fair and equitable distribution, but many rich countries are not signing up to it. And I think they seem to forget that as long as COVID remains, it will keep being a problem, regardless of, it's a global problem. It's not a country by country problem. So I hope there's some consideration given not just to distributive justice within a country, but also in terms of how we help other countries get the vaccine. So the disease disproportionately affects populations that have poor access to healthcare. I think that's where we need to focus first. We also need to focus on the elderly. We've seen that this disease has come at great cost to our elderly population. And so we think we need to focus there as well. And we also need to sort of keep in mind that these companies that are developing the vaccines want to make money out of it. So the vaccines are going to arrive at high cost. It's not going to be available for everyone, except for countries that are really rich and are going to buy up the stocks. So we need to have that in mind when we think about the vaccines. Okay, so that's all I have to say about COVID-19 vaccines. I will return to it when in the Q&A, and I'm happy to answer any questions you have about what I've shared with you so far. But let me turn to a situation where I think we actually need to have a mandatory vaccination policy. And that is mandatory vaccination for childhood infectious diseases. So again, to remind you, by mandatory vaccination, I mean legislation requiring vaccination as recommended by experts. And one that only allows for medical exemption or exemption based on proof of natural immunity. There are some other types of policies that people refer to as mandatory that I don't consider to be mandatory. So let me run through them very quickly. There's the vaccinate or homeschool your kids approach with only a medical exemption allowed. So if you don't vaccinate your children, then you have to keep them at home and homeschool them. They can't attend school, and only a medical exemption is allowed. So that some US states, such as California, West Virginia, use this approach. And then there's vaccinate or homeschool your kids, but all kinds of exemptions are allowed. Medical, religious, and philosophical exemptions are allowed. I don't think these are mandatory vaccination policies, even though people tend to think of them as mandatory vaccination policies. Why? Because they provide for vaccination contingent on school entry, which I think is too late. Children need to be vaccinated from 1 year of age. And I think waiting till school entry is too late. And I also think that when you make it contingent on homeschooling or on school entry, you have allowed an alternative or a choice that parents who don't want to vaccinate their kids can take. So it's not truly mandatory. I think if we're going to criticize mandatory vaccination, we should at least criticize the real thing, not something that is pretending to be mandatory vaccination. A third approach, which we find in Canada, in Ontario and New Brunswick, is vaccinate or stay away from public school, with, again, all kinds of exemptions allowed. So under this approach, you can send your child to, say, a charter school or a non-vaccinating school, but you can't send them to public school. I think these policies are suboptimal, and the approach that I've outlined as the mandatory approach is the one I think is truly mandatory, but also has the potential to do the most good when it comes to childhood infectious diseases. So I'm going to argue that routine mandatory vaccination of children represents the best balance of all of those features that I talked to you about at the beginning of this talk. And so I'm going to run through those features rather quickly in the hopes of convincing you that we need to vaccinate children from when they're eligible for vaccination, which is 1 year of age, and we need to make it mandatory. So the first thing is, when it comes to childhood infectious diseases and the vaccines that address them, compared to, say, what I discussed with you about COVID-19 vaccine, the vaccines that target child infectious diseases are quite safe and effective. I know there tends to be debate about this, but I really will not debate anyone on this. It's really not controversial. It shouldn't be controversial, even though it is. It is very clear, based on all available information that we have, that vaccines that address child infectious diseases are safe and effective. Anyone who doesn't believe this, I cannot convince you. So there'll be no need to ask your question. We just say that disagreement and move on. But here's some data. From data we have in Canada, and it's very spotty data. We don't collect data as regularly as we should. So the data is not as robust as it should be. But data we have shows that the serious adverse events that arise from vaccination in children is quite low. The way I like to summarize this data when I give talks is that if you think about the number of children who get vaccinated in Canada, and then you think about the serious adverse events, and by serious adverse events, that doesn't mean that the kids died. It means that they had, say, a fever for longer than they should have. So what is considered serious adverse events does not include death or, a child suffering from a serious disability. It's things like having a fever for longer than they should, or having to be hospitalized. Things that are quite unusual happen. The data we have, the adverse events are so low. I think the adverse events for over-the-counter drugs is even worse than what we have for vaccines. So vaccines, in a nutshell, vaccines are quite safe. When the ones that target child infectious diseases are quite safe. We also know that this is the most effective tool for tackling national and global childhood disease burden and disease burden in general. Vaccines are very effective. When they have been shown to work for a disease, they tend to do a really good job. The way I like to explain it is that I cannot think of any other health intervention in the history of humanity that has done more for the most people than vaccination. I challenge anyone to come up with any other health intervention that has had the kind of impact that vaccines have had. I think the only one that probably compares is separating poop from water. Other than that, I can't think of any other health intervention that's as effective as vaccines. Here's some information on that. According to the US Centers for Disease Control and Prevention, in the US, among children born during the 2 years here, vaccination will prevent an estimated 322 million illnesses, 21 million hospitalizations, and over 700,000 deaths during their lifetimes. You just don't see those kind of figures for any other kind of health intervention. We know that vaccines have led to the global eradication of many diseases. Smallpox has been eradicated. Polio, which is a terrible disease, is nearly eradicated. Measles was eliminated in Canada in 1999 after they introduced a second dose of the MMR vaccine. It came back when people stopped to vaccinate their children. If you look at the chart to my right, what you're seeing on that chart is a list of diseases in the United States that have been affected by vaccines. So vaccines have reduced the incidence of those diseases, either eliminated them or led to their near elimination or eradication in the United States. So in that chart, the syringe with the red showing is the impact the disease had on the population in terms of morbidity, in terms of deaths, prior to vaccines being introduced. And on the where you see the red disappearing is, either the disease is now gone or it is substantially eliminated. And that's because of the influence of vaccines. Again, I think this is fairly uncontroversial. Even though people like to argue about it, I think it is very clear that vaccines have done more good for humanity than any other health intervention. But we also know that vaccine-preventable diseases are making a comeback. So we have vaccines available. In countries like Canada and the United States, these vaccines, well, actually, I don't know about the United States. I know about Canada. In Canada, that these vaccines are freely available. You can get them by simply taking your child to get vaccinated. They're free. You can get them whenever you want them. And even though we have vaccines available for these diseases, which are terrible diseases for children, these diseases are making a comeback because people are not getting their children vaccinated. We know that vaccine coverage is not optimal. Now, what we'd like to see is 100%, but if you take away people who cannot be vaccinated, who have a medical reason not to get vaccinated, we're looking for coverage rates in the high 90s. But we don't have herd immunity for many of these diseases. But I also think herd immunity and high coverage is not enough. We really need to make sure that we get as many people as can be vaccinated. Because sometimes people tend to refer to herd immunity as a shield. So they go, I'm not going to vaccinate my child because we have herd immunity or we're close to it. And I think that argument worries me because every child who can get vaccinated should be vaccinated. It is true that if you have herd immunity, the chance of the disease spreading is low, but that doesn't mean your child will still not get it. But also people tend to misunderstand what herd immunity actually means when they see herd immunity statistics. There are some problems with herd immunity that I think should make us not sort of use it as an argument for not getting children vaccinated. The first is that herd immunity is typically measured against an entire population rather than specific populations. So when you see herd immunity figures for Alberta, that figure represents Alberta as a whole and not Alberta in terms of specific communities or target populations within Alberta. So herd immunity, for example, herd immunity rates for Alberta, for example, does not tell you much about herd immunity in Edmonton. It doesn't tell you much about herd immunity among certain populations in Edmonton. It also doesn't tell you much about herd immunity in, say, southern Alberta or other parts of Alberta. And so when we hear the term herd immunity, we assume that vaccination is distributed equally among the population, but that's never the case. It's never the case because there's significant variability in vaccination coverage. And I think that sometimes people tend to use herd immunity as a scientific justification for not getting their children vaccinated, when the truth is that the coverage rates are not uniform throughout the province or throughout the country. So here's an example. I'm going to do a case study to sort of illustrate this point. The herd immunity target rate for measles in Alberta is 95%. So that's if we have 95% of the population vaccinated, then if measles makes it into the community, chances are it will not, the chance of spreading is very low because there's enough people vaccinated that it won't take a foothold in the community. But when you start to then look at the actual coverage rates in Alberta, you start to see a divergence depending on how you how you query the data. So we know based on coverage rates from 2013, the last time we have the last available information we have, that 84.8% of 7-year-olds in the highest income quintile, so more affluent populations, essentially are better vaccinated than those who are in the lower income grouping. And so what it suggests is that, people who are rich tend to be better vaccinated than people who are poor. And this tracks sort of access to healthcare and how people get information about how they can access healthcare. Now, you'll note that these two rates are not up to herd immunity target, but it's actually worse for persons in lower economic quintile. And so what that means is that if measles comes into the community, it would affect people who are from poorer backgrounds than those who are from richer backgrounds. That is something that isn't often highlighted when we talk about herd immunity. We also know that some populations have much lower vaccination rates than others. So measles vaccination rates in Southern Alberta is much lower than the provincial average. So it doesn't matter whether you throw out numbers for the provincial average. What really matters is that some communities in Alberta are exposed in terms of coverage rates. If measles makes it into those communities, it's going to get to a lot of children. So if you look at the information on this slide, only 46.6% of 2-year-olds are immunized in Fort Macleod. The rates of vaccination in Fort Macleod is really low. The highest in Southern Alberta is in Oyen at 71.9%. So if measles makes it into Southern Alberta, it's going to have an impact on a lot of children. What's going on with Southern Alberta? It is home to many unique, homogeneous, non-immunizing communities where they don't vaccinate. They don't immunize their children. They're typically secluded communities. They're homogeneous in the sense that the population is people from same type of background, and they tend not to vaccinate their children, mainly because of religious beliefs that disease is the will of God, and if they're going to get disease, they'll get disease, and so they tend not to vaccinate their children. So they don't benefit from this herd immunity story, and parents in these communities don't really care about school entry laws. They typically educate their children in private schools. And Alberta doesn't have a school entry policy anyway. For the most part, we don't have any sort of policy that makes any sense when it comes to vaccination. Now, many of you will recall the 2013-2014 measles outbreak in Alberta. I remember it very well because our second daughter was born just days really before the outbreak started, and we're very worried about it because she was born premature. And spent quite a bit of time in the hospital in an ICU. And when we brought her home, we were really worried about having her contract measles because she was obviously immunocompromised in many ways, and we're worried that if she got measles, that would really be terrible for her. So we basically had to go into lockdown because she was very vulnerable. But that outbreak, it's interesting how that outbreak started. And I very quickly want to tell you the story of the outbreak. So ground zero for the outbreak is right in the middle of this chart. And that is a non-immunizing religious community in Lethbridge County. Members of this community had gone to the Netherlands to visit their relatives and brought the disease back from the Netherlands. It was a kid of around, I think, 12 years of age who brought it back and then took it to school, and the disease then spread. Now, if you look at that chart, you can see that it spread very quickly in Southern Alberta. That's because Southern Alberta is not properly vaccinated for measles. The coverage rates are not very high. So it spread in Southern Alberta. That's what I mean. If it comes into that community, it's going to have an impact. When this kid took it to school, it affected a lot of other kids at school. All of them at school were not vaccinated. All those impacted were obviously not vaccinated. That's how they got the disease. So the right side of this chart, the two small circles that are not connected to the Lethbridge outbreak, that's Edmonton. I think that outbreak started from the Edmonton International Airport, and it was quickly put out. Why? Because Edmonton is better vaccinated. So vaccine coverage is variable across the province and across the country. we know, based on existing data, that coverage rates have not reached where we wanted to get to for herd immunity. We know that children, when they get this disease, are impacted, especially those that are vulnerable. We've seen situations where children who are vulnerable, who are immunocompromised, are infected by other children who are not vaccinated, who have measles. There was a case, for example, out of the U of A hospital, where a kid who was undergoing chemo for cancer was infected by another child who was not vaccinated, who showed up at the hospital. So I think, if you look at this context where we have a vaccine that's freely available, you can access it. We have a disease that affects children and can be serious. Many of these diseases can be serious for children. It can lead them to die. And we know that there are children who are at risk. So children who are younger than 1 year of age, where they need to get the vaccines, are at risk. Children who are immunocompromised are at risk. We know the vaccines are safe and effective. I think all of these are reasons for us to have a mandatory policy that ensures that all children get vaccinated. This is no longer the elephant in the room. There are many organizations, such as the Canadian Medical Association and the American Academy of Pediatrics, who are calling for mandatory vaccination as well. Now, the only argument that people maintain against mandatory vaccination is that it is an interference with parental choice and personal liberties. I accept that it is an interference with these two things, but I don't think it's compelling enough as a consideration to go when you balance it against all of the things that I've just told you. I also think that it's important that we understand that in this context, a parent is making a decision for their child. That decision has to be in the best interest of the child. And I wonder if it is really acceptable, in light of everything I've shared with you, to say that the better decision, the decision that is in the best interest of the child, is for them to forego vaccinations. Because there's no compelling reason for the parent to maintain that position in light of what I've just shared. If the vaccines are safe and effective, if they are freely available, you really should get it for your child. If not, you're making a bad decision for your child. Now, having said that, I still think there's a need to ensure that parents are educated about the benefits of vaccines, that their questions are answered about, the questions they have about safety are answered. And I think we should do as much as possible to make sure that people have information from accurate sources that address their questions about vaccines. But at the end of the day, we do need a policy that at least forces them to go out and ask those questions. And I think a mandatory policy is one that will do that. Now, for those of you who might be interested in sort of the legal questions around mandatory vaccinations, some of you might be asking, is it even consistent with our Constitution and with our Charter of Rights and Freedoms? Is it an interference with our human rights in Canada? I don't have time to go into all of this because I want to allow time for questions, but I can assure you, I studied this for my doctoral research. I looked at all kinds of cases where courts have had to consider whether or not forcing someone to get vaccinated for the sake of the community is something that's an interference with human rights. And in all cases, courts have said, yes, it's an interference with human rights, but it's justified interference. It's justified in the sense that when the community is under threat from a disease, it is okay to use something that is an effective remedy and which has been shown to be safe as a means of controlling that threat to the community. And vaccines will fall into sort of this reasoning that where it is shown to be safe and effective, you should use it to protect the community. Okay, if you let me keep talking, I'll keep talking. So I'm going to shut myself up. I think I've made the main points. I'll just very quickly sort of touch on 2 points. A mandatory policy is effective. I think it's important to address that. Yes, the short answer to it is yes. Where we have policies that make people get vaccinated, as I said before, some of these policies are not truly mandatory, but where we even have policies that say you can't enroll your child in school unless you get them vaccinated, even with exemptions, we tend to see the vaccination rate go up. So it's better than doing nothing. And so I think it's the right option for child infectious diseases because it is the most effective based on the data. It's a legally valid impairment of rights, as I've argued. There's good safety profile for these vaccines. You want to really have something that makes people get out there and ask questions, and you want to have a consistent policy across the country so you can raise vaccination rates. But I also think it creates an obligation on government to address the worries that people might have about vaccine injury. If you're making it mandatory, then you have to provide for any injuries that arise if people do get vaccinated, even though that's not likely to happen for childhood vaccines. I think for all of these reasons, we need to make vaccines for children mandatory. But I don't think these reasons necessarily exist for COVID-19 vaccine when it becomes available. So that we should not make mandatory. Okay, I'm gonna shut up now and take your questions. Thank you for listening.
Well, thank you very, very much, Professor. That was fantastic. And that's lots of learning for me anyways. That's great. Do we have any questions? I see one question here right now that says, what do you see as the ramifications if there is a vaccine that does not work?
Well, if it does not work, I'm hoping it doesn't get licensed. I'm hoping it never makes it to the clinic or to the market, and it shouldn't. We actually have processes in place to ensure that if it's not effective, then it doesn't get approved. My worry is that the process of licensing and approving these vaccines the process has now been politicized, especially in the United States. And as you've seen from that chart that I showed you about the COVID-19 vaccine, that is the country where we have the most vaccines in development. So I'm worried that the politicization of the process may lead to the approval of a vaccine that does not have the right safety and efficacy profile. I'm hoping it doesn't happen. In Canada, we tend to take something like that more seriously. So I don't expect us to see a vaccine in Canada that is not safe or effective. So the short answer to your question is, if it's not effective, it will not get licensed. But if somehow it gets licensed because of politicization, I think that will do more harm than good. Because what we'll find, I think it'd be terrible if people started to get this vaccine and then ended up still getting COVID. And that will lead to a lot of distrust in vaccines in general. And it might have sort of this crossover effect to other vaccines. The last thing we need right now is for people to start to think that vaccines don't work. So I'm hoping it doesn't get licensed if it's not effective.
Right. I think that question might be also in the context that there are some vaccines that are out there now that we think should be working fairly well, but then people still do get sick. So an example might be someone who gets the flu vaccine, and yet they still get the flu. But from the scientific perspective, I know that the flu virus itself mutates, and it doesn't always mean that you're getting the same strain of flu that of which you're vaccinated. So can you comment on that, please?
Right. So that, when I said we don't have, vaccination programs are not created equal. They don't all have the same features. That's what I meant. The flu vaccine is a different beast. The flu vaccine is not like the COVID vaccine or like vaccines for childhood infectious diseases. Here are some differences. The flu vaccine is based on viruses we know about already. So it only addresses the strains that we know about already. It doesn't address new strains. So because it's always backward looking and not forward looking, you might get the vaccine. You could get the vaccine and still get the flu from a new strain of the flu virus. That does not mean that the vaccine is not effective. It just means you got a new strain that the vaccine does not address. We also know that the immunity that the vaccine confers is not lifelong. So it's not like a vaccine for, say, smallpox. The immunity only lasts really for the season you get it for, because there's going to be new strains of viruses. The next season doesn't confer lifelong immunity. It does confer immunity for the viruses that it addresses. So I think that's another sort of point of difference. So it doesn't mean the vaccine is not working. When you get the flu, it doesn't mean the vaccine is not working. It just means you might have a different strain. The other reason why you might get the flu is that the vaccines don't just start working from the minute you get the vaccine. It's possible that you already have the virus, and by the time you get the vaccine, the virus still makes you sick. The vaccine is also manufactured from viruses. And so there are viruses that have had they've been weakened. And so the way they work is when you get the flu vaccine, it triggers your body to think it's been attacked by a virus, and it then triggers your immune system to then prepare it so that if the virus does affect you, your immune system is already trained to attack that virus. And so because it's weakened viruses, when you get the flu vaccine, you might feel off for a few hours or for a day. That doesn't mean the vaccine is not effective. When I got my flu shot this year, I felt, I had a bit of malaise for a few hours and I was fine again, but now I'm protected. And it would be wrong of me to say that it wasn't effective in the period where I wasn't feeling my best. It's not like I got really sick. So I think that's a totally different beast. And much different from childhood infectious diseases, where we know that if you do get, so for example, for measles, if you get the 2 doses of the vaccine, you're good for life.
Okay, great, thank you. I have a question from Victoria who asks, what if we have a patchwork of different COVID vaccines from different pharmaceutical companies? Will we get to choose which vaccine, or will we be told what is available to our area?
Hopefully, yes. Hopefully, the government will provide information as to which vaccines they've chosen to go with and why they've chosen to go with that vaccine. As you've seen, there's many of them in development. I think the government of Canada, there's some that are being developed within Canada. And the government of Canada is already making plans for acquiring some of these vaccine stocks when they become available. So I think there'll be very good information about what vaccines are available and why they've chosen to get that and not other vaccines. And that is something I'm hoping they'll do in a way that leads people to actually have very good information about what vaccines are available. I hope they don't do a poor job of communicating information about the vaccines, because I think it's really important for the COVID-19 vaccine program that the government gets the communication right, that public understanding of the vaccine is very good, and that we know the source, we know how it works, we know the data on safety and data on efficacy. I think all of that is important. So I would agree that the government needs to do a really good job of making sure that they pick a vaccine and they give us information about what vaccine they picked and why they picked it. I suspect that at the end of the day, we're not going to have a ton of vaccines available. I really don't think so. I think a safe guess would be a couple at most. I don't think we're going to have a plethora of vaccines available. Of the 141, I'd be surprised if any of them make it. But if one makes it or 2 make it, that's actually success in my opinion.
Wonderful. That actually is a good lead into the next question from Sarah, who says, do you think there should be a policy against private media companies allowing and publishing vaccine misinformation, or would that be a constitutional violation?
That's a great question. So should they be banned from publishing vaccine misinformation? Well, I don't know that a ban will be effective, and I don't know that it might be unconstitutional. They might claim you're interfering with their freedom of press and their freedom of speech. So yeah, it will be challenged for sure. But I also don't know that it'll be really effective. I think what's better is to have a national strategy for fighting misinformation. I think the government should be less concerned about trying to ban, misinformation. I don't know how effective that will be. If you ban it, you're just going to move it on the ground, or you're going to energize the people who actually want to sow misinformation. It's like trying to ban the anti-vaccination movement. You just energize people when you start to ban things. I think it's better to, unless something that doesn't exist in Canada right now, a national strategy for fighting misinformation. It is sorely needed. I think we really need to sort of get together as a country and have the government think through how we can devise a way of addressing misinformation, because it's becoming a massive problem for how we do things in our country. We now have the counter knowledge and counter misinformation starting to gain a foothold in our society in a way that's scary. It's becoming part of our ethos. People are actually now starting to think of counter knowledge and counterfactual things as things that they have a right to talk about and things they have a right to sort of put out there in the public space. And we know it's causing a lot of damage. And I think it's high time the government form the strategy for dealing with it. But I don't know that a ban on private media companies will be very effective.
Right. There's a new question that came in from Caroline before I read another question that came in from registrations. Caroline asks, says, first of all, great information, Dr. Ogbogu. Thank you very much. Currently, Alberta does not collect any race-based health information. Our society is becoming more ethnically diverse, and this information is essential. My question is, what are your thoughts on Alberta joining Ontario and Ottawa in collecting this data to help communities and societies in general with healthcare, medical intervention, vaccines, and the like?
Well, my thought is that I agree with you, wholeheartedly, that we should be collecting information that allows us, all kinds of information that allows us to be able to sort of know about our health system and about our population and about how different populations and different communities are experiencing opportunities and sort of things, personal opportunities as well as impacts. So I don't know if that's a question so much as in you've made a statement that I completely agree with. Of course, we should be collecting race-based data. Of course, we should be collecting data about how people live and who people are in Alberta and how things affect and impact them and the kind of opportunities that they have and the kinds of disadvantages that they face, because it helps us plan better. It helps us direct our resources to where it will do the most good. We've seen with COVID-19 that the lack of information about health disparities and about certain communities has allowed for the disease to have impacts that we can control. We've seen that it disproportionately affects communities of color, and we don't have good information about the extent of it, simply because we often don't have a way of collecting information about how, in a systematic way, about how these impacts are felt in this community. So, I don't know that I have anything more to add to your question other than to say that I agree with it. I think we should be doing it. I think we should be collecting data in a systematic way about the populations that we have within Alberta and about how the opportunities that they have and how things impact them, such as the pandemic.
Right. I've got one last question that came in from the registrations, and it's a 2-3-parter question.
Okay.
Okay, first of all, this is the good one. What do you believe is the most constructive way to engage with anti-vaxxers and to address their fears, first of all? Secondly, do you believe that this hesitation will continue to grow with future pandemics, as we've seen with COVID-19 anti-maskers and anti-vaxxers? And lastly, is this bout of infectious disease a new phenomenon, or do you believe that hesitation and denial has existed all along before the modern vaccine?
Great questions. So the first, you're going to have to remind me of each of them as I go along. The first one is with respect to
Constructive.
anti-vaxxers, right? And what is the most constructive way to engage with them?
Yes.
So I think we should distinguish between the so-called anti-vaccination movement or anti-vaxxers and something called vaccine hesitancy, right? Because there are people who are hesitant to get vaccines for what would be legitimate reasons, right? They don't have good information about vaccines. They don't have good access to healthcare. They have legitimate questions about safety and efficacy that no one is answering, or they've been exposed to misinformation and they want, they're then hesitant because of misinformation and they're not getting corrective information. So there are a lot of reasons why persons may be hesitant. And I think I like to put them in a different category from people who are actually opposed to vaccines. So with people who are opposed to vaccines, I actually think the best way to deal with it, and I think that this is a very fringe group of persons. Let's be very clear about that. I think you're going to find vaccine hesitance in the population, but people who are truly anti-vaccination, they're a very fringe group. And I don't know if we should be necessarily reacting to that. I think we should maybe focus our attention on making sure that we do things right and we provide good information to people about vaccines. We make sure that vaccines are safe and effective. We encourage people to get vaccinated. And we have a policy that actually triggers the need to get vaccinated. I think if we had a mandatory vaccination policy, anti-vaxxers can, scream to high heavens. It wouldn't matter. We're going to have vaccination rates go up. But how do you deal with them? What is the most constructive way? In my experience, I don't know that you're disagreeing with them on vaccination. I think these are just two worldviews that never come together. So I think, for one, you shouldn't engage them in an adversarial way. Don't lock them up or don't try to shut them down. I think you should just counter the information that they put out there with your own information. So I think having, as I suggested before, a national or provincial strategy for addressing misinformation will be the most constructive way. Because, I've debated, I've had conversations with anti-vaxxers. Nothing you say convinces them. Mm-hmm. It's like day and night. You really can't, there's no meeting of minds. And increasingly, I have stopped doing that. So I have stopped, if somebody invites me to give a talk or, to give an interview on radio and they say, we're going to bring an anti-vaxxer, I just decline. Because I think that's sort of promoting a perspective that actually does harm. So I think perhaps the most constructive way is to just have a strategy for addressing misinformation. Okay, second question.
Second question again was, do you believe that this hesitation will continue to grow with future pandemics?
Yes, it will continue to grow unless we do something about it. It will continue to grow because we're living in an age where we're exposed to many sources of information, and much of that information can be misleading, right, or just wrong. We're also living in an age where we've seen governments try to undermine expertise and faith in science and in experts. So this is a time where we should be rallying around people who actually study these things and trying to sort of use the knowledge that is gained from all of these studies to try and prevent the problems we're facing as a society and as a global community. But we're seeing the opposite happen. We're seeing governments undermine this information. We're seeing people put out misinformation. We're seeing, because we're exposed to so much information through social media, we're seeing people, gain access to information that wasn't there before. Right. So I think it's going to continue unless we do something about it. And I think what we need to do about it, as I've already said, is come up with a strategy for dealing with it. If you ask me to design what our strategy should look like, I would say the first thing is we need to have very clear policies on some of these things. I think government should not equivocate. That's what government is there. If you need to use the powers, incredible powers you have, use it. So on things like, should we vaccinate children for infectious diseases? I think government should just come out and say it's mandatory. That's the way it is. That's the way it has to be, because that helps healthcare professionals do their job. So I think we should have good policies, but also we should do something about misinformation. If we don't address these things, of course it will continue, and of course we'll keep seeing a divided world where people are exposed to all kinds of information, and we'll keep having these sorts of debates that we shouldn't be having.
Right. And I guess that dovetails very well to the last question, which was, again, is this doubt of infectious diseases a new phenomena, or do we believe that hesitation, denial has existed all along before modern vaccinations? And part and parcel, you've answered part of that with that response of there's so many sources of information now, and because the science changes, people really don't know what they should be believing anymore.
Yeah, it's always existed, unfortunately. In fact, as some of you may know, the very first vaccine was developed for smallpox, the disease smallpox. It was developed by a fellow named Edward Jenner. This was in the 19th century. And he developed the vaccine because smallpox was a terrible disease. He had smallpox as a child, and he went through an experience where that he didn't very much like, and so he spent most of his career. He was a doctor and a naturalist, and he spent much of his career trying to find a solution to the problem of smallpox. And then he came up with the very first vaccine. After he developed it, there was also a ton of controversy around that vaccine, and all kinds of misinformation about the vaccine, and huge debates they had that time in England and in many other parts of the world about whether the vaccine was safe and whether it worked or didn't work. As a matter of fact, mandatory vaccination was debated at the time as well. There were some jurisdictions that made vaccines mandatory. There was a time when Canada made vaccines for smallpox mandatory, and that was very much resisted. The notion of conscientious objection that some of you may be familiar with, this idea that if you have an objection based on your religious beliefs or your philosophical beliefs, that came up in the context of the smallpox vaccine. That was the first time people expressed an objection of that sort and then named it conscientious objection. So we've always had these debates. As a society, we've always struggled with the tension between individual choice and personal liberty and community protection. None of this is new. The only new element is the proliferation of bad information. It's one thing to try to spread misinformation in the 19th century. It's another to try and spread it in the 21st century, where I can just go on Twitter and tweet it. So.
Right. That was going to be the last question, but I just received a question on chat that's so good that I can't say no to it. So
okay.
That very last question is from Garrett. And he asks, are there policies in place to ensure Indigenous peoples have good, proper access to vaccination? Or is it similar to the discriminations seen in healthcare overall?
That's a great question. The short answer to the question is no. No policies as far as I know. And as a matter of fact, that is one of our failures as a country. Indigenous health, Indigenous healthcare. I think it's really it's a blight on our country, how we've dealt with that. Indigenous healthcare is not up to the standard we should expect of a country like Canada. It is not on par with what non-Indigenous Canadians receive as healthcare. And when I said, we need to think about distributive justice, that's what I was hinting at. When the vaccine becomes available, we need to think about the impact on certain communities, including Indigenous communities. And that impact is felt in those communities because COVID-19 is a disease that tracks poor access to healthcare and poor living conditions and poor social conditions. And so it is having a disproportionate effect on Indigenous communities. And so I will expect us to have a policy in place to ensure that communities like Indigenous communities and other communities of color are the first to receive these vaccines when they become available. But presently, as far as I know, those policies are not in place. And I do think, we should talk, maybe a talk for another day, that the state of Indigenous healthcare in Canada is really, for us, a national disgrace and something we really need to do something about.
Okay, thank you. Okay, so Professor, can I have you please unshare the share screen? I want to see everybody before we say goodbye here. Thank you. Well, thank you very, very much, Dr. Ogbogu, for taking the time to speak with us about your knowledge and on the learning journey and answering the questions. It was very, very appreciated. Thank you so much. We appreciate your knowledge, your sage advice, and your engagement with the community.
Everyone.
Thank you.
Thank you, everyone. I appreciate you staying on and listening in.
Absolutely.
And please feel free to email me if you have any questions.
Okay. Thank
I'll be happy to answer them. Thank you.
I'd also like to thank our facilitators that worked with me today to make sure that the event went smoothly. So Emily, Lee, and Chrisanne, thank you so very much for all your help. And last but not least, I want to thank all of you for participating and joining us today, and the patience as we go through some of our technology challenges from time to time. But it was wonderful to see everybody. Thank you so very much. We invite you to continually watch the U of A page for events and the Speakers Bureau page for other events like this. And until then, we wish you a fantastic weekend. Thank you so much for joining us.